The Department of Health is concerned about the high death rates linked to tuberculosis. According to the Health Minister, Dr. Joe Phaahla, there are 300,000 people that are diagnosed with TB every year. Professor Norbert Ndjeka is the Director of Drug-Resistant TB and HIV at the Department of Health, and he joins us now to identify or help us identify where the gaps are, Prof, that we're seeing the numbers increase. Good afternoon.
Yeah, thank you so much for inviting me to this interview. I'm the Chief Director responsible for TB control and management at the National Department of Health. In fact, we've identified a number of gaps in terms of our TB control. And the major one has been that we're not able to find everybody with TB. Like Minister announced, we have 300,000 people with TB every year, but last year we managed to diagnose 224,000 and treat them. So the gap between the 224,000 and 300,000, that gap of around 76,000 people is the problem, because they are not diagnosed and they transmit the disease in our communities. So that's really the major gap. But there have been also other issues in terms of prevention, which has not been well done in the past, and we're improving all that.
Let's start with perhaps the problem of diagnosis, where you have a number of South Africans who are walking around and they do not even know that they have been infected and therefore run the risk of spreading it to others. What is behind the low diagnosis levels?
So traditionally we would screen, meaning ask you 4 questions. Are you coughing? Are you losing weight? Are you having fever? Are you sweating at night? Before we test for TB. But our TB prevalence survey indicated that up to more than 50% of people with TB in South Africa don't have symptoms. That is why we started a different approach. We now test regardless of symptoms. In the high-risk groups, those are people who are close contact of individuals who have been found to have TB through laboratory tests, people living with HIV, and also people who have just completed their treatment. They could relapse. So in those categories, 3 high-risk groups, we do tests regardless of symptoms. And that's why we're now able to see more people. Like I said, last year we diagnosed 224,000, but if you look 2-3 years back, it was below 200,000. By changing the approach, we're now testing more and finding more.
On the prevention side, what can be done to bolster this?
So in terms of prevention, we're really looking at measures like in our public transportation, but also when people congregate. When you have a lot of people, you need good ventilation. Without ventilation, you have a problem. People get TB when they are in the vicinity of those who are infected. We know that the BCG is protective against severe forms of tuberculosis. It helps children early years of life, but BCG vaccination that we all get at birth is not very helpful in protecting against tuberculosis in the lungs. So we're hoping that TB research will come up with a vaccine that is effective. But before that, we just have to go primary prevention, good ventilation, but also people at risk, like those living with people who are infected or people living with HIV. We also provide TB prevention therapy with 6 months one or a 3-month therapy. So those are some of the measures we put in place to prevent tuberculosis.
Your message to South Africans?
The message is really that if you are contact close contact of someone who's been told that they have TB, you need to test for TB, whether you have symptoms or not. If you are coughing, you could be having TB. You need to go for test. If you are found to have TB, take treatment and finish treatment. More importantly, when you go to a healthcare facility, provide your accurate cell phone number, because we do send SMSs to everybody that gets tested for TB in South Africa. And you would get your response by SMS, whether you have TB or not. And you are found to have TB, please go for treatment, start treatment, and finish your treatment.
Professor Norbert Ndjeka, Director of Drug-Resistant TB and HIV at the Department of Health, thank you very much for your time.